get started here. Thank you so much, Dr. Lopez, for joining us today for the Visual DX Wednesday webinar, Visual DX Plus Derm Expert, Learn What's New. My name is Audra Huber, and I am the Clinical Account Director for the Midwest for Visual DX. I'm here with Dr. Azeen Sadigian. She is a practicing dermatologist from Baton Rouge and a user of Visual DX, and I'll let Dr. Sadigian introduce herself as well.
Hi, I'm from Baton Rouge, Louisiana, practice dermatology. I am a Visual DX groupie, meaning I've been using it ever since my training, and it's been a great clinical resource for me, so I'm happy to be a part of this team and to help share some information about Visual DX.
Great. So just to give you a little briefing on what we're going to talk about today, first we're going to go ahead and start with Derm Expert. From there, we're going to talk about some telemedicine, as well as our long-standing commitment to skin of color. And from there, we'll move into a few other features of Visual DX that not a lot of people always know about. And then we'll end with questions. So yeah, I'm just going to move over to my Apple device to show everyone our Derm Expert feature. So let me know when you can see my phone.
I don't see it yet. Oh, now I see it.
All right, great. Thank you. All right, awesome. So Derm Expert is one of our newest features in Visual DX, available on mobile devices, both Apple and Android. Derm Expert allows non-dermatologists, specifically derms can use this too though, to take a picture of a skin condition, and then we're going to be using machine learning and AI to analyze that photo, tell you the lesion type, and then guide you to the differential diagnosis with a simple set of questions after the photo is taken. So let me go ahead and show you an example of that. In order to use Derm Expert, either you need to click on the little camera icon on the top right there, or if you click on dermatology, you'll see where it says take a skin photo. And you'll see I've got my laptop there. It's like I'm taking a picture. I'm going to go ahead and select a photo from my library here. And I've got my Visual DX photo album here, so just some photos I have saved. So this image actually is an image from the University of Maryland, where this patient came into the ED. They were unsure as to what to call this lesion. This patient, she had a similar lesion that was hanging off a piece of skin. She tore it off herself, and it grew back to about 4 times the size. So she was very concerned, went to the ED. So we're going to go ahead and analyze that photo. And we'll confirm the lesion type from there. So you'll see that we've got these, there's a bar underneath each of the lesion types that indicates the likelihood it's that lesion. So you'll see at the top there, friable papule, it's very likely that is the correct lesion type. So we're going to hit select there, hit next. And then we can change our patient demographic. She was just slide our finger across the top, a 60 to 69-year-old female. And this was a single lesion or growth, so we'll choose growth or lesion at the top. You can also choose limited area or multiple areas if that was what the patient was representing as. So single growth or lesion, and it was on the finger, so we could select that it was on the finger. Then hit next again. And then just that simple set of questions I had mentioned. Does the affected area itch? No, it does not. It developed acutely. The appearance of the patient, so were they well, ill, toxic? They were well. And then we can view the differential diagnosis from there. So when the ED team at the University of Maryland saw this top image, they clicked on that. And they scrolled through these images of friable papules, lobular capillary hemangiomas. And when they got to this specific image here, they zoomed in, and it was very similar to her lesion, same area of the thumb as hers was much bigger though. And then when they read through the summary, they realized, you know, the rapidly growing benign vascular proliferations, and they had that aha moment as this was the disease. They also provided the patient with a handout that could be printed or emailed, and you can include an image with that as well. So we can go ahead and, you know, choose an image that looks similar to our patient and send them off with that patient handout. So, so that is DermExpert. I just want to share with you, I'm going to jump back over to my desktop.
And while Audra's doing that, I do just want to share that DermExpert is a great tool. It's not meant to replace a dermatologist in any way, but equip non-specialists particularly in knowing how to triage patients appropriately. So for example, in the ER, sometimes you don't know, is this somebody I need to send urgently to a dermatologist? Do they need to be there within like the next few days, or can it wait a week or two? And it's almost like having a little dermatologist pocket buddy to be able to say like, okay, this is how you should triage them or manage them until they can see a specialist.
Thank you, Dr. Sadikian. So if you could see my screen here, just sharing how Visual DX and DermExpert can help with telemedicine now that we're, you know, with the pandemic, virtual care has been on the increase immensely. So how this could be used is, you know, the parent or patient can take a photo of them or their family member. They can, you know, text you or send you that picture. And then what you can do as a clinician is use that picture within DermExpert to then get to that differential diagnosis. So here you'll see the doctor, you know, is looking at this image. I mean, you would do this on your Apple device or Android device, you know, comparing that to pictures as well. And then you can also email the summary, the patient handout back to the patient. So that's certainly how Visual DX and DermExpert can be used in telemedicine. And then DermExpert can be used, you know, for a virtual appointment too, in that you can share your screen and images of Visual DX with the patient while you're virtually talking to them.
And I think the useful aspect of this in telemedicine is that patients are not necessarily right in front of you, and so it's a little bit harder to garner trust. They're not confident that you're necessarily able to appropriately diagnose them because they're not physically there. And so this helps alleviate some of those doubts and also creates a safety net, which I appreciate in the sense that, okay, pictures, if you've ever had a friend text you a picture, you know how difficult it is to diagnose from that. You're almost like, oh, I wish I could see it in real life. Well, to be able to use DermExpert is kind of like augmenting your brain a little bit, because you're not only looking at it and trying to figure out the diagnosis, but you also have an algorithm, you know, artificial intelligence looking at it as well. And you're able to kind of combine that with your own knowledge base and say with more confidence, okay, yes, I do think it's this. Also, whenever you're doing a virtual visit, being able to share your screen, you're able to say, hey, you know, conditions like this, these are the symptoms you told me, and look, this lines up with this diagnosis. And they're able to see that, okay, this is almost like you're showing them a textbook. They're able to see that, oh, my symptoms match up. Oh, these images look just like mine. And they feel that confidence, like, okay, my doctor got to the right diagnosis. And then being able to send them that summary and treatment option, you don't have to spend time typing it all up, having your nurse type it all up. Like, it's just click and go. And whenever you're sending the handouts, your email address is not being saved. The patient's email address is not being saved. It's all done very securely in a HIPAA compliant manner.
Thanks for that feedback. We appreciate it, Dr. Sadikian. It's great input. So just moving on to our next topic. I know that with recent events here in the U.S., racial diversity, racial disparities in medicine has been a really big topic amongst, you know, health systems and medical schools. There was a study that was released just a few months ago in the Journal of Academic American Dermatology that examined medical resources for the representation of skin of color images. and how this is really important not only for clinicians to better diagnose skin conditions in patients who are skin of color, but also, like Dr. Siddiqian had just mentioned, sharing those images with patients to instill confidence with them and make them feel like, yes, this is what I have, and this treatment makes sense to me because this is the diagnosis. So within those examined resources, Visual DX was ranked first out of the online resources for representation of skin types 4, 5, and 6 on the Fitzpatrick scale. So you'll see here that 28.5% of Visual DX's image collection, which is now of over 43,000 images, was of the darker skin types. And I'm going to flip over to Visual DX itself so I can go ahead and show you exactly where you can find those skin of color images to help with that diagnosis. So in just a second here, you'll see my screen, which will be the Visual DX homepage. Are you seeing that, Dr. Siddiqian?
Mm-hmm.
Great. So I'm just going to go ahead and type in just a simple diagnosis. So if you're a new user to Visual DX, this search bar is your best friend. You can type any patient complaint, any disease, medication, travel into the search bar. So to keep things simple, I'm going to just search for psoriasis as our diagnosis here. And I like to search for psoriasis to show our skin of color images in that we have a very large library of psoriasis images. So if I click on, let me go back one step here. So you'll see if I click on this view all images here in the top right, those will be on the forefront of my screen. I'm going to click on filter images and then click on skin pigmentation. So here you'll see we could filter by skin types 4, 5, and 6. So you can see, the difference in variation and presentation of psoriasis and dark skin, and also share that with your patient.
And I'd like to add the reason why this is so important, being able to see clinical images and skin of color, is because we know that in practicing medicine, we're not practicing for just our location or our demographic, but we practice global medicine. And what that means is you're not only just limited to seeing who's in your community with travel and how people are spreading across the world, you're going to see people of different demographics in your own practice. And so in that last slide that Audra showed us about the JAD article, what I want to point out is the fact that what they were comparing it to were all the dermatology textbooks that even I trained with. And dermatologists, we train specifically to try to know all the different skin types. And so if our textbooks are lagging to that degree, but Visual DX kind of shines above and beyond, I want to say that's because Visual DX embraces this whole global medicine mission, meaning that we have doctors who are collaborating all across the world to share this information, to share images. And so that way, we're really in one community as practitioners and physicians. And so this is really helpful to be able to better care for your patients. And another aspect is a lot of times people with darker skin types, they try to Google search things and they're not even able to find good images either, but you're able to show your patients like, look, here's somebody who has a similar skin tone as you, and they have the same spot on the same area, and they're like, oh, that looks like exactly what I have. And once again, it's garnering that trust. Like, you really hear what they're saying, and it creates a connection between you and the patient.
And to add one more thing to what Dr. Siddiqian just mentioned about Google, Visual DX images, we are evidence-based. This is a curated library of images from some of the best institutions worldwide. I mean, these are from, very reputable doctors and clinicians who are, the best in their field. And, we also have an editorial board of over 100 clinicians who write for us too. So this is, really great evidence-based medicine, whereas you're looking at Google, you don't always know if that's really, it's, a trusted vetted source for images.
Yeah, you just try Googling yourself and you'll see images of other people.
Exactly. My boss likes to give the example of anthrax. When you do that, when you Google anthrax, you'll get pictures of the band. So not necessarily how anthrax presents in, as an infection. So, and as a diagnosis. So I'm just go back to the start here. you know, with the pandemic still being on the forefront of everyone's minds and still very, very important to know about, I'm going to share with you our COVID-19 content. So within Visual DX, if you're new to this, there's a synopsis for each disease. So we have a synopsis for COVID, just like we did for psoriasis and we have for every other disease in Visual DX. You have your top level ICD-10 codes, what to look for each disease, your diagnostic pearls. So this is all pithy handbook-length text that's really easy to read at the point of care. You have your textbook differential, access to tests, management, and therapy. All of our references as well, all of our PubMed references. And I have to go ahead and show you our COVID images because we were able to source quite a lot of radiography images of COVID, all that are have citations to talk more about, you know, what's happening in the image and more about the patient. We were also able to source numerous image of COVID toes. So with a disease that has so many different presentations and variation, and still very much new to medicine, new to our minds, it's really great to have access to content like this, you know, from other experts and other sources. So I just wanted to make sure I shared all of this with you, as it's very important to learn from.
And
Anything?
what I would like to add to this, because I think COVID was a great example. I personally witnessed this of Visual DX, how dynamic and responsive they are to medical conditions of concern. So COVID was kind of this new thing for a lot of people. And I know a lot of you guys are probably, okay, like we've heard about COVID this whole entire time. But in March, when this was happening, this page was updated daily. And so what I appreciate about it is, you know, I don't know everything there is to know about COVID yet. I can't afford to miss a case like that. And so even though I have not personally treated a patient for COVID, I need to be aware of it. And so it's like you have this team of librarians who are able to pull all the information from all the articles that you don't have access to, or you may have access to and you just don't have the time to pull them all together. And in real time, they're pulling the newest and best information, and they're creating like this book report summary for you, so you can just glance at this and know that you're reading up-to-date information. And you know, this is the beauty of using an app like this. It's able to be updated in real time by the entire medical community. Like, the reason why there's so many images is because we had so many physicians sharing their proven COVID cases. And then another thing I appreciate about this is the differential diagnosis and pitfalls page shows us that, okay, even though we have something that is flashing right now in the news and the media and it's in the forefront of our minds, it doesn't mean that other things aren't happening, right? And so you guys have probably heard of fewer people were being diagnosed with heart attacks, either because they weren't coming in or because we were missing the diagnosis. And so you're able to say, hey, let me take a step back, even though COVID's on everybody's mind right now, could I be missing something else? And so what's my differential? Because I think sometimes we kind of get to a diagnosis too quickly and we forget that there are other dangerous things out there. And so that differential diagnosis also helps.
Thanks, Dr. Sadikian. We've got about 6 minutes left before we're going to take questions. So I'm just going to show everyone a few other features of Visual DX that sometimes go missed, but they're very important. So within Visual DX, you can search by a medication and build a differential based off a medication. So I can say my patient who comes in is taking naproxen, and we'll say that this patient who's taking naproxen, they have a blanching patch, and we'll say this is we'll say it's a 60 to 69-year-old male with taking naproxen with a blanching patch, and then view the differential from there. So really important that, patients could be on numerous medications, and it could be something new that is causing their medication reaction, or it could be something that, they've taken for a while that they may have developed some type of reaction to. So in this case, could very likely be a fixed drug eruption that's caused by naproxen. Here you'll see where we have this little pill icon where there are 16 citations in PubMed. That's case reports that naproxen has caused fixed drug eruptions. And then when we go ahead and open up our diagnosis here, our diagnosis page, we can also compare, images to our patient to see if, they're very similar to their reaction. Any additional comments there, Dr. Sadikian?
Yes, if you can go back to the differential builder page. So, sometimes a patient tells you something and it makes you hinge on a diagnosis, or like okay, I think this is drug related. They said they started naproxen a while back. And as you can see on the differential page, there were multiple tabs, and there was one that was drug induced. But what you can always do if you're like, okay, it just doesn't match any of those, you can go to your consider first, second, your emergencies, or your infectious etiologies, because sometimes what the patient tells you and they're hanging their hat on, it's not the piece of information that's going to help you all the time. We hope it is the one that helps us, but sometimes it leads you down the wrong path. And so I appreciate this because you're able to take a step back and say, okay, let me look at this objectively, because the patient is going to be subjective in sharing what they share with you.
Thank you. And then very similar to searching by medication, we could search by travel. So we could say maybe our patient just returned from the Bahamas, and we'll say that we're going to say this is a 20 to 29-year-old male. They're on, maybe decided to travel on his honeymoon, has a fever and joint pain, and we could just type these into the search bar rather than going through the guided workup here. And we could view our differential from there. So now we're looking at everything infectious from the Bahamas that presents with fever and joint pain, everything endemic to there. So this, much different than looking at dermatologic images. We have what are our sympticons. So these sympticons are just illustrations of where the key features of each disease lie within the body. We find that they're easier to compare and contrast at the point of care. And this is just a really great way to and there's no way every physician can memorize everything endemic to every country, region, state. So we've developed a way for you to build a differential on that right within Visual DX. So you can search by even by a region or a US state to build that differential. And to go along with that travel piece, I would also like to show you that within Visual DX, we have translated Visual DX into multiple languages: Spanish, Latin American Spanish, Portuguese, Dutch, French, Mandarin, and Japanese. You can also change your region as well to go along with that. So then when you do searches, they will be endemic to that area. I just wanted to ask Dr. Sadikian just for a few more comments and input as a user and champion of Visual DX before we take any questions. Anything else to add?
Yes, I love this app. I think the more you use it, the more you realize it has features to help you. And we just kind of touched the surface of it. On the left-hand side of the screen, I do want to point out that there is all this up-to-date information for things that are pertinent to what's going on right now. So right now it's COVID, but we're at another natural pandemic. You're going to see that there too, which makes it really easy. Also, the 3 buttons underneath the search bar I think are really helpful. So, if you don't have the mobile app, you can use that button to help get it set up. And then also CME. I think this is the easiest way to earn CME, and it's honestly one of the most affordable ways to earn CME. And you can do that there. And then public health and education, these also have some high yield topics that you can directly link out to. So Visual DX, has grown. It grows every single month, and it encompasses orthopedics, cardiology. There are so many different aspects in the house of medicine that it's covering now that I really feel like this is something that's not only useful to help you diagnose a patient at bedside, but also to learn from. I wish I had this whenever I was in medical school, but I started using it in training, and it helped me out tremendously then, and I still use it in practice today.
Thank you. So we're happy to take any questions that you might have. Actually, before we do, I would also like to share with you all that tomorrow we're hosting another clinical webinar called On Treating Acne with a Tetracycline class of antibiotics. The webinar is at 2 p.m. Eastern, and feel free to, what I'll do is I'll go ahead and put put a link to the webinar in the chat here, so you can all go ahead and sign up if you're interested. So, yeah, happy to take any questions that's Dr. Siddiqui and I can answer from the attendees. Thank you so much.
Thank you.